Today, we are very excited to have our CEO, Tracy Sopkow. She's here to provide an overview of our 2024 to 2027 strategic plan.
Thanks, Lindsay, and thank you everyone for joining us this morning. Like Lindsay, I see a lot of familiar names and faces, and so thank you very much for taking time out of your morning to be with us. And for those of you I haven't had the pleasure of meeting or interacting with, I look forward to that moving forward. For those of you who are familiar with RhPAP and the work that we do, I don't think you'll see a significant departure in our strategic plan from what we've been doing over the past 33 years as an organization that has worked really well in terms of, helping rural Alberta keep healthcare close to home. And it, for many of us may not feel like it at this point in time. But I think collectively, we all play a very significant role in ensuring that the health workforce that we need in rural Alberta to keep our rural Alberta communities vibrant, is a challenging job ahead of all of us. But I think one that over time, with our collective effort, we'll be able to make some headway on. So, Lindsay, if you just want to go forward one screen, just a little bit of a reminder about the mission and the vision of RhPAP. And so, we really are here as an organization that was founded over 33 years ago. First off, as a physician-centric organization. However, our mandate was expanded by the Minister of Health in 2017 to include all regulated health professions in this province, is really to ensure that our rural communities have the effective workforce they need to deliver care. And our mission, really hasn't changed. The board relooked at it as part of this strategic planning process, and it really is to serve as that trusted voice for our rural communities, focused on building partnerships and linkages and delivering on initiatives and programs that help our rural communities keep healthcare providers close to their homes. And so, Lindsay, if you want to kind of go one more, I'll just have you pause on this screen for a bit. And certainly for all of you on this call, you all appreciate that across the province, our rural communities are facing unique challenges in accessing quality healthcare services. Things like limited resources, geographic isolation, and workforce shortages have created these barriers that are fundamentally threatening the health and the livelihoods of our rural residents. And so RhPAP's role over our history has been to help foster a sustainable health workforce and to improve health outcomes in rural and remote communities in consultation and in collaboration with our partners and our stakeholders. And developing this new strategic plan was a collaborative and a valuable process. The board began the work back in June of 2022 with the aim of building out a focused plan. And in its construction, it included consultations with stakeholders. It had input from the board and the staff, and we sought to ensure that there was alignment with various Government of Alberta plans and reports and mandates. And we've identified 5 strategic directions to guide us over the course of the next 3 years, which you'll see here on the screen in front of you. And that is kind of focusing on a longitudinal approach. And that is 1, starting with high school students in our high school to healthcare approach. Moving on to post-secondary to practice. How do we support learners in post-secondary who are pursuing healthcare careers into practice environments, and particularly those in rural communities? As they move on to practicing health professionals, how do we invest in them to ensure that they have the tools and the continuing medical education, the continuing professional development they need to thrive in their rural communities? Working with community around capacity building. And this is where our attraction and retention committees play a significant role in the work that, we're able to do. And lastly, but not least, is demonstrating RhPAP's impact. And so I'm just going to take a few minutes now here and move into each of them and kind of define for you what we're going to do. So Lindsay, if you want to move on to the next slide. Yeah, we can just skip this one if you don't mind. So as we talk about high school to healthcare, we really identified kind of two key action steps in this area. And that is, one, to develop initiatives that will inspire high school students to pursue rural healthcare careers and to promote those careers as a viable path for high school students. And so, we know, and as do many, that interest in rural medicine begins in high school, is really then decided when they get to the undergraduate medical education stage of their career, and then is reinforced in postgraduate training. And that's why one of our pillars is high school to healthcare. And of course, that's just looking at physicians. But, we can see that pattern showing up in other healthcare careers as well. And so, by targeting rural high school learners, what we really want to do is aim to cultivate a robust pipeline of those future healthcare professionals through that kind of grow your own approach. And our Let's Go Rural High School events really serve as a platform to showcase rural healthcare careers. But more importantly, the full breadth and scope of career options. We want kids growing up in rural high schools to consider the non-traditional and the allied health professional disciplines just as well as they would consider things like medicine and physicians and nurses. So this past year alone, our fiscal year ends on March 31st. This past year alone, we had over 270 high school students from 27 communities participate in these events. And so, we've got some great feedback from the students who take part around the impact that these events have had. Therefore, moving forward over the course of the next 3 years, we really want to expand these events so that we can serve more high school students in more communities. And to help us do that, we're focusing on building and leveraging a cross-functional multidisciplinary steering committee that is intended to help us inform the delivery of these events to ensure that they're locally relevant, that they're engaging, and that they really take into consideration some of the shortages in workforce in specific communities. And so how can we highlight professions in certain communities that are experiencing specific shortages at a given time? And I think, in order to inform all of the work that we do, research is a key component. And so we have not in our past here in RhPAP really undertaken any research to understand high school students' perceptions of rural healthcare careers, what they perceive as barriers in their pursuit of those careers, and what their likelihood of returning back into a rural community to practice should they pursue a rural career is. And so over the course of this year, we're going to really engage in that research to find that out so that it can actually also inform another information series that we offer to high school students, which is our Let's Go Rural, How Do I Get There sessions. And so if we can understand their perceptions, understand the barriers, and understand their intentions, then we can construct more targeted information sessions for them to help remove those barriers and answer those questions. Lindsay, can you move on one screen? So when we move on to our post-secondary to practice, we've kind of identified 3 key areas in this that we're going to pay particular attention to. And that's ensuring that post-secondary learners have access to tailored programs and supports to explore rural learning opportunities and careers. We really want to amplify RhPAP's role as a connector between those learners when they're out in those rural communities and the communities themselves. And we want to expand our financial support for post-secondary learners. And so through this post-secondary to practice strategy, you know, we really want to ensure that those tailored programs allow those learners to explore rural practice fully and deeply. And, you know, that transition point from post-secondary education to practice can be a really pivotal moment in a professional career. And so to help them understand what rural practice is, not only from the clinical perspective, but also from the living perspective, we offer mentorship opportunities to first and second year medical students right now, to provide them with that, to partner them, I guess you could say, with an experienced rural physician who can demonstrate firsthand how fulfilling practicing and living in a rural setting can be. And right now, that program, which allows first and second year students to spend part of or all of a weekend shadowing a rural physician, is oversubscribed. And we need to focus here over the course of the next year on recruiting rural preceptors within driving distance of the post-secondary institutions to help us expand and respond to the need of that rural mentorship program. The other thing that we really want to do is understanding and appreciating that it's not only physicians that are key providers of our healthcare system. We'll be looking to work with our post-secondaries across the province to offer those mentorship opportunities to other allied health learners as well, because it's important that RhPAP kind of move away from its physician-centric past and really focus on the full spectrum of healthcare careers in this province. And so that's going to be part of our work. Very similar to our Let's Go Rural high school events, we do Let's Go Rural post-secondary events, which expose about 100 post-secondary learners a year to the rewards of rural practice. And so, like everything, again, back to that, moving away from that physician-centric approach, we focused on medical learners in the past in terms of these events. But given the high demand in rural communities for all health professions, our intention is to, really expand the program to include a much larger group of learners. And so we have started including nursing students in that. And really, it's an opportunity to get on a coach bus on a Friday and go out to a rural community, tour a facility, meet some of the healthcare providers in that community, and then also get to understand what life in that community looks like and some of the key highlights. And response from individuals who have gone on those experiences is very, very positive and very strong. With respect to post-secondary learners, our accommodations program is a significant part of the work that we do. And so at any given time, we have over 130 leased accommodations across 40 rural communities, which serve as really a vital resource for over 700 medical students, residents, nursing and allied health students who go into rural communities as part of required and elective rural placements of their programs. And RhPAP's ability to provide free furnished accommodations is aimed to alleviate the barriers associated with rural training. But what I can tell you is that demand right now is currently outpacing our available resources. And so we've proactively identified about an additional 350 healthcare learners from 13 post-secondary institutions who are annually required to complete a rural placement as part of their program. And so that's why we really want to focus on maximizing our accommodations portfolio, and certainly, with support from government over the next 3 years, trying to expand the number of healthcare disciplines that we're able to house in rural communities. Because we all know that the earlier they receive exposure to a rural community and the longer they have exposure to a rural community, the more likely they are to choose a rural career. And so that accommodations portfolio, while it seems simple to us, is really kind of a vital way to introduce them to a rural community. But then more importantly, once these learners are in those rural communities, we want to work with our A&R committees and local government and local volunteers to really find ways that we can welcome and engage these learners during their placements. We want to ensure that while we don't infringe on their privacy, we do want to find ways that they can be integrated into the community and that they don't just focus on work, that they actually are given every opportunity to experience firsthand what life is like in that community. And as I've alluded to earlier, I think research here is also incredibly an important component of understanding the issue around rural workforce. And so our intention here is also to undertake some research, and we do have a research analyst on staff and have had one now for about a month. And so once her feet are kind of settled, she'll begin working on some of these projects. But we don't understand a lot from our perspective around what influences a learner's willingness to practice in a rural community. What are the personal and professional factors that inform their decisions? And what are they looking for in a community from both a practice and a lifestyle issue that will keep them there? And I think more and more so we're hearing from not only our student groups, but certainly from our professionals practicing in those communities, challenges with daycare and appropriate and affordable housing and transportation. And so how do those factors influence their decisions to stay beyond just the clinical environment and the interdisciplinary teams that they're working with? And so we'll be using that research to inform some of our strategies moving forward as well. Lindsay, can I get you to move forward one? Investing in healthcare professionals. And so I think this is an incredibly important component of the work that RhPAP does. Once we get healthcare professionals out into rural communities, how do we ensure that they have access to the continuing medical education and the continuing professional development they need to offer enhanced care in their communities and stay in those communities? And so what we do through this area will be to continue to facilitate robust educational offerings for them, utilize return of service commitments where they make sense. We know that in some cases they work and in some cases they don't, and certainly financial incentives are a part of the equation, but they are not the solution. We want to ensure reasonable access to locum coverage for our practicing rural providers and invest in rural research and quality improvement. And so funding for training, research, quality improvement, mentorship of health providers, and those return of service programs where they make sense are vital components of ensuring long-term viability and success. And so as we invest in continuing professional development, we ensure that those rural practitioners stay up to date on the latest advancements, best practices, and evidence-based treatments. And we do that through a number of programs where individual providers and teams can apply to RhPAP for funding to ensure they have access to that training in their own communities. We understand how overworked they are. We understand how there is a burden to travel sometimes into an urban environment to take that training. And we don't want those to be factors that prevent them from pursuing continuing medical education. And so we want to do everything we can possible to ensure that they have access to that in their communities with the teams that they work with on a daily basis and in the environments that they practice in, just to provide them that leg up. And so that's kind of where we'll focus and continue to focus in those areas. Our return of service programs that we have had in the past offer incentive to practice in rural areas. And so with funding support from Alberta Health and Advanced Education, we introduced and ran the pilot program called Reside, which aimed at physicians within the first 5 years of practice who received a financial incentive to return to a rural community in need. And so that program was a pilot, and it has now run its course. And so we will be following up with the physicians that were part of that program to ensure that they have all the supports they need to remain in the rural communities that they have chosen. And then last spring, we introduced what is known as we call it the BIN program, or the Bursary for Internationally Educated Nurses, with funding support from Advanced Education. And so that program offers bursaries for internationally educated nurses who are living in the province of Alberta to pursue a bridge training program at a qualified post-secondary here in the province in exchange for a return of service in a rural community. And so, as I mentioned earlier, they're a part of the solution. But they certainly aren't a means to an end in terms of solving the whole issue, but they certainly can go a long way in helping with workforce shortages and some service disruptions by returning healthcare providers into a rural community. We're seeing some great early positive results from the BIN program, and that at the end of March, over 150 nurses had already received financial support to complete a bridging program in exchange for that return of service in a rural community. And since March, we just continue to see the number of applicants to that program continue. So it's been positive, and we'll know and be better able to assess the results as the first kind of cohort begins to graduate from their bridging programs later this year, and as they move into those rural communities. And so, in conversations with Alberta Health and Advanced Education, we'll continue to look at return of service funding programs that may kind of be the next cog in the wheel towards some of these workforce challenges. And again, you all appreciate this. I certainly am just stating the obvious for many of you here in this call today, that our healthcare professionals in rural practice environments are consistently overworked and in short supply. And so that's why we're going to continue to ensure rural physicians have reasonable access to weekend and senior locum coverage. And by connecting healthcare providers with locum opportunities in rural communities, the locum program really helps bridge that gap caused by workforce shortages and allows our overworked and overwhelmed rural physicians the chance to take a much needed break. And so we deliver that program in partnership with the AMA. It's kind of nice because it allows urban physicians who want to keep up their skill sets the opportunity to go out into a rural community. But like everything, the locum program, it does everything it can to fill the demand and the number of requests it gets, but it is subject to the same challenges that our rural communities and our health workforce is challenged by as well. And I haven't grown up in a rural community in northern Alberta, and kind of going back and seeing how healthcare has changed in there and how the community has changed. I think we can all understand and recognize that as healthcare services are lost, our rural communities become less sustainable. And, confronting these challenges is going to require targeted measures. such as expanding rural medical education programs. And I know the U of A and the U of C, in partnership with Northwest Polytechnic and the University of Lethbridge, are, kind of taking the initial steps to expand those rural education programs starting next fall with the distributed learning schools. How do we stabilize our workforce? And how do we tailor healthcare to meet the unique needs of our individual communities rather than trying to find a one-size-fits-all approach? And so I think that's part of RhPAP's reason for investing in rural healthcare practitioners through our research and quality improvement grant stream, so that they can help us understand the issue firsthand and be part of the solution. And so when they apply to us for funding for research and quality improvements, they're really looking at how can they help address gaps in rural healthcare relevant to our mandate, how can they inform public policy, and how can they improve rural practice. And so we're a catalyst to that by allowing for the funding to be available for them to do that. In turn, how we leverage those results to inform change is part of the equation. And we're also going to, I alluded to 2 research projects I know that we really want to focus on, but we have a whole laundry list of other research projects, I think, that over the next 3 years, we really want to dig deep into to really help us understand gaps and priorities to inform our programming and to help shape public policy. Lindsay, if I can get you to go one more, please. Creating community capacity is an incredibly important component to the work that RhPAP does, and really truly the fundamental cornerstone of how this organization was conceptualized 33 years ago. And so we're committed to building purposeful relationships with new and existing stakeholders and fostering these relationships, as well as maintaining and growing that strong and diverse provincial attraction or retention network, who have accomplished some incredible things in their communities over the years, but certainly not at the pace that we all would like. And so we want to continue to grow those networks, and then really act in a leadership role. We're very privileged to be able to hear information from communities, volunteers, healthcare providers, and provincial and local leaders across the province. It's a lot of voices and a lot of information that we have the opportunity to hear. And so how do we synthesize and collect that information so that RhPAP and its many partners can be aware of what the current and future needs are in our rural communities, and how do we best prepare ourselves to respond to them? And so a former board chair of mine and a mentor used to always remind me that Blockbuster didn't go out of business because it was a bad business model. They just failed to look into the future and anticipate what Netflix would mean to their business. And I think we all have that same responsibility, is to really try and remove ourselves from the current situation that we're in and look to the future, and be aware of what changes and trends and opportunities may be coming our way, so that we can start taking the necessary action now to be ready for the future. And healthcare, it's the basic human need of all of us. It's kind of that fundamental equalizer between all of us, and it's an absolute requirement for vital and vibrant rural communities and rural citizens and rural businesses. And the dwindling number of medical students who are opting for family medicine just really intensifies this issue. And that concerning decline in students who are electing family medicine as their first choice of practice over the last number of years I think signals a trend and a problem that we should all have an eye to. But it's also concerning because it demonstrates that we're graduating fewer family physicians across the country. And, Alberta is no different than all of the other provinces in this country. We all need those family physicians and those healthcare providers to sustain quality care. And in this province, our rural residency programs are struggling to meet workforce demands. And so I see some University of Calgary folks on the line who are in those programs, and they do, incredible work. They have well-established rural programs at both the med school and the residency levels, and they're incredibly effective in training future rural physicians. They have a success rate of 70% on average, with about 70% of their graduates moving on into rural healthcare workforce. But I think until we see the programs, the distributed sites come out in Lethbridge and Grand Prairie, the programs traditionally have been quite small, and there's only 32 spaces a year, and they possibly can't train enough physicians to meet the demands of our rural communities. And so it's an issue that's going to take time for us all to work our way out of. And in those rural communities, it's incredibly unfortunate that when emergency services and obstetrical care are disrupted for rural patients, and sometimes they're disrupted for long periods of time. And once they're compromised, they're difficult to restore, and they're often lost permanently. And so the availability of comprehensive healthcare is a major factor in our rural communities that influences whether young people who grew up in those communities or those who grew up elsewhere and are interested in pursuing life in a rural community, access to that comprehensive healthcare is a factor in their decision making. It also determines whether our aging population can remain in their rural homes. And it certainly tops the consideration for businesses who want to attract and maintain a healthy workforce by doing business in a rural community. And so over the course of our time as an organization, one of the cornerstones of our work has been in building that community capacity. And we really understand the critical importance of having a skilled and dedicated health workforce in rural areas. And we're committed to initiatives to attract, integrate, and retain them. And, I wrote those words down today, and I don't take my own advice sometimes, because it just is natural to say attract, integrate, and retain. But I think we all need to start considering that, and how do we flip the order of that? How do we retain the ones that we have first and foremost, and what can we do to ensure that they are satisfied, not only from a clinical and a career perspective, but they have that opportunity to live rewarding and fulfilling lives in rural communities. And once our retention efforts fail, then how do we move on to attracting them to our communities? And once we have secured them in those communities, how do we integrate them? So I should probably take my own advice in how I phrase that. And many of you on this call who are in the business of education, or who are in the business of recruitment for AHS and others, or who are members of health advisory committees or RhPAP's A&R committees, we're all equally committed to the vibrancy of our rural communities. And when I look at our attraction and retention committees as a whole, I'm really proud to say that at the end of March, we had over 500 volunteers on those committees, representing 164 communities and 59 identified and uniquely distinguished A&R committees. And that's incredible. And that's a testament to the vested interest in continued vibrancy of rural communities. And so over the next 3 years, we really want to grow our A&R committees and the work that we do. And, RhPAP has a history of going where it's been invited as opposed to going where it's needed. And so, as our committees kind of ebb and flow with maturity and need and community, I think we need to take a much more proactive approach to identifying communities that need assistance and that need help, and just may not know that RhPAP exists, or may not know that we can help with their initiatives and help them structure A&R committees. And so, much more intentional and much more mindful over the course of the next 3 years around identifying those opportunities. I think it would be remiss if I didn't say we want to continue to serve as a trusted partner to the Ministry of Health and to advanced education, and certainly to AHS and Covenant Health and our post-secondary institutions, and the other key stakeholders that we partner with throughout the community. And so, this would be my offer to say that RhPAP is here to support, and we're open for business and collaborative discussions and opportunities to leverage strengths and resources from everyone interested in this issue. And I think we're only stronger together. And so for those of you on this call that we haven't had that opportunity to have those conversations and explore those opportunities, please do reach out, because we can't do it alone, and nobody can do it alone. And I would never even begin to claim that RhPAP is the only one doing this work, or the only one that should be doing this work. It's very much an all hands on deck approach. And then I think we, want to continue to advocate in good faith for the healthcare needs of our rural communities, to government, to our pentagram partners, and to really collaborate on innovative and practical solutions. And at the heart of it, that is what RhPAP is here to do, is to kind of be an open and willing partner to think outside the box and to do things differently. And in order to do that, the only way we can do that is by hosting meetings and events and having those conversations, and really focusing on convening a group of innovative yet practical thinkers who can consider ways to implement solutions to our health workforce challenges. And so if we can be a connector, that's a role that we really want to play as well. Lindsay, can I get you to go to the final screen, please? And we really focused at this time on part of the strategic plan on demonstrating impact, and I'll explain why that we want to define RhPAP's distinct value proposition and leverage its voice and tell the story of our impact. And I think there's a lot of work over the 30 years of our evolution that has been done. And I would say somewhat we've been remiss at really kind of quantifying that impact. And, that's an important part of any work, is really truly understanding and looking back both critically and closely at what you do, and does it work, and is it making a difference? And there's no ability to grow and evolve and redefine the work that you're doing if you don't kind of take that lens off of I work too close to the issue, to really examine whether or not what we do is working. And so we really want to, over the course of the next 3 years, is to be loud and proud about what we know does work, and then open to doing things differently where we see that, maybe it isn't making the difference that we think it is. And so focusing on telling the story of our impact is going to be part of our work over the coming years, and, highlighting the work that we do, importantly, with the partners who are at the table with us. And so we really look forward over the course of the next 3 years and the rollout and the evolution of this plan to ensure that people living and thriving in rural Alberta have the best care they possibly can. And, welcome you all to be part of this and to assist us with this work. So I'm going to stop talking there and certainly put out the offer. Lindsay, if you could shut that, stop sharing your screen, really put out the offer to all of you to certainly reach out and to have discussions with myself or any member of the RhPAP team that you are coordinated with and that you are connected with around how we can further our relationships and leverage the work that we're all collectively doing. So I'll stop there, and certainly if there's a question, I'll do my best to answer it at this point. And if I can't answer it for you today, I will make it a priority to get back to you with an answer. Oh, I see, Karen, you have a question about to create these additional programs. These are all programs that RhPAP is currently funded for. And so it's a mixture of how do we grow them through economies of scale, and how do we grow them through maximizing our impact and finding ways to do things differently and a little more efficiently. But these are all programs that we are currently funded to do.
If we have fixed quotas in the post-secondary institutions for healthcare professionals, does it mean that those institutions will increase quotas to facilitate rural needs?
That's a great question, and certainly one that I think is better answered, Robin, by our post-secondary institutions. And this will be a shameless plug, so please take this with a grain of salt. But RhPAP hosts its Attraction and Retention Conference this fall in early October in Wainwright. And both doctors Aaron Johnson and Mark Prins will be one of our speakers that day on the Wednesday, October 9th, talking about rural medical education and the program's abilities to influence rural workforce. And so I know that they're going to speak at that conference, but they're also going to be able to hang around and answer questions. So if you have any opportunity to attend, anyone on the call, I certainly would encourage you to consider registering and attending the conference. And I recognize, Robin, that October is a long way away to be able to get an answer to that. But unfortunately, I can't speak knowledgeably to the university's enrollment quotas. Sid, I see you have your hand up.
Yeah, mine's so Sydney Saviskov, Senior Advisor for Talent Management Strategies, Allied Health Provincial Strategies. I don't have a question, that's more of a comment. So I recently had a conversation with a new grad SLP who was looking at Calgary and Edmonton, and I was able to persuade her to go rural. When I commented on Calgary and Edmonton, she wouldn't be able to purchase a house, but if she went to a rural location to check out the housing market there, and as a new grad would be able to afford a new house. And it was an aha moment for her. And so she's now looking at postings within our organization that are rural and looking at the housing market there so that she can actually get into the housing market, whereas in the big centers, she's not able to get into the housing market due to costs. So just food for thought for the future. That's one thing rural has got going for it over the urban centers, is that cost of housing and how affordable it is, especially for new grads.
Yeah, it's a great point, Sid. And I would just say SLP for everyone on the call is a speech language pathologist. which, you know, certainly is something that many rural communities don't necessarily have as a service. So that's a great way to put it. I would just make one argument back, Sid, is that I think that's rural community dependent. Certainly the entry cost is lower than it could be in an urban environment if there is inventory. And what we just see through some of our accommodations programs is that inventory in some rural communities is quite low. And so it's about finding that balance between that cost and that available inventory. But you're right, there are certainly advantages to living in rural communities that need to be highlighted to these new grads who are considering where they want to practice.
I had a question come to me in the chat, Tracy, from Ashley Hadley with the RMA. She was wondering, how might the Alberta Health restructuring impact RhPAP?
So right now, our understanding is that you know, the impact won't be substantial, certainly on our operations. Ashley, you know, I think like everyone, we have a lot of questions and there's a lot of unknown answers at this point. You know, and so we'll just have to wait over the course of time as this restructuring takes place to kind of really figure out where there will be impact. But our mandate and our commitment to supporting our rural healthcare providers certainly will not change. It just may be a little differently in terms of how we access them through a different employer. But I think those are problems that can be worked through when they actually, and if they actually arise.
Tracy, I have one more question in my chat from Robin. Says, do you utilize the international licensed professionals and work with them to increase their awareness about opportunities in the rural areas while they're going through the relicensing process?
Yeah, we certainly try. But if you have any suggestions, Robin, around how we can access them directly, I think we would certainly be welcome to that. You know, sometimes getting access to names and data to be able to contact people directly is a little more challenging. And so we rely, unfortunately, on broader public messaging. But if there's a way, or you have a suggestion on how we can connect more directly with that particular group, I would certainly appreciate your guidance on that. Please reach out. info@rhpap.ca is our general inbox, and you know, it will make its way to me or some member on the RhPAP team that can assist you. But you know, I think we are all collectively interested in this work, and we all have an important piece to play in this work. And you know, we're here to collaborate with all of you, and would like to explore those opportunities. And if you do get a chance to check out the agenda for the conference, October 8th, 9th, and 10th in Wainwright, I can tell you it's going to be a very, very rewarding and a very action-packed conference. We certainly are spending one night at the base, getting some live demonstrations and having dinner in the mess hall. So if you ever wanted to learn about healthcare and have an experience on a military base in Canada, Wainwright is the place to do it. So please consider joining us in Wainwright as well.
Thank you all for joining us, and we appreciate your comments and questions. And as Tracy mentioned, reach out anytime with suggestions or comments or questions, and we'd love to be in touch.
Great. Thank you, everyone. Have a great summer.